Dr. Kosterman with Kosterman Chiropractic in Cary, talking about probably the most important treatment if you have a lumbar disc herniation, disc bulge, slip disc. There's a million things for them. People throw their back out, they're walking crooked, pain shooting down their leg. If you've had it, you know what I'm talking about. If you haven't had it, you probably know someone who has had it because you've seen them crawl around the house or the living room or in and out of their car. But what can happen is this, if we're looking at a motor unit, right? You have a bone, you have a disc, you have a bone. This disc has a lot of fibrous rings around the outside and it's incredibly strong. And on the inside, it's kind of like a toothpaste. It's called the nucleus. If that gets damaged enough, it'll actually push through those fibers and come out and hit that nerve, right? And when it does that, it'll run down your leg. And if you've experienced it, again, you know what I'm talking about. But in a healthy spine, this nerve has plenty of room in this nerve window. We call it the IVF. That's where the nerve lives. It's attached to the spinal cord, which runs up and attaches to the brain. So you don't want to pinch that nerve. Not only does it go down your leg, in the lower back it runs the colon, it runs the prostate, it runs some other important muscles, organs and muscles, sensitivity to the leg. But if it's compressing, if it's pushing, look, if I'm showing you this, I'm having to compress this, right? So it seems like what would be the solution to this would be to decompress it. So we actually have a table that's attached to a computer in the office and it actually decompresses the spine, right? So when you pull, you create what's called a negative pressure, which is just a fancy way of saying vacuum. What do vacuums do? They pull or they suck. They're gonna pull back that disc material off of that nerve, back where it needs to be. So then guess what? The disc can begin to heal and then the nerve can begin to heal, right? So you're addressing it without having to go in there with an aggressive surgery. I haven't sent a patient to a surgeon in quite a while. We used to send them before we had this technology in the office, but I haven't had to send one to surgery in probably 8 years since we got these tables. And I'm not kidding, I used to send them for neurosurgical consult because when you have a rough disc herniation or a bulge or what's called an extrusion or even a sequestration where that chunk actually pushes out, breaks off and can get caught in your spinal canal, used to have to send those patients to the surgeon, but we haven't had to do that in a while thanks to this wonderful therapy. It's very gentle. You lay on a nice table and it gives you a subtle pull. It's not anything large or big or abrupt, but over the course of time we can allow that disc to heal. Another good way to think of it is if you have your full spine, we kind of strap you in very gently on that table. And then what it's going to do is it's actually going to, if it's compressed, it's going to decompress that area, right? So over time, it's going to pump and build back fluid in that disc after it pulls in that bulge to rehydrate that disc or put water back in the balloon, if that makes sense. So if you're struggling with this or you have a family member or friend that's struggling with this, give us a call, give us a chance to help. We're actually really good at it. So we look forward to seeing you soon. And if you have any questions, just give us a call.